Good evening and welcome. It's essential to talk about perinatal mental health because of the way it affects the parent, their partner, their baby, the family, and society at large. And who better to have this conversation with than Dr. Ashlesha Bagadia, who, as a perinatal psychiatrist and psychotherapist with impeccable credentials and years of clinical experience under her belt, offers mental health support to parents through pregnancy and postpartum at the Green Oak Initiative in Bangalore. So let's wait for Dr. Bagadia to join in and ask her to share her wisdom. So I think perinatal mental health is a really big issue because it affects 1 in 5 parents. It affects the birthing parent and equally the partner, and it can affect the unborn fetus, and it can also affect the baby at birth, the attachment that the parent would have with the baby, and lactation, sleep, and all the attended issues that spring thereof. So let's wait for Dr. Bagadia to join, and I'll take the conversation forward. Hi, Dr. Ashlesha. I'm not able to hear you. Yeah. Oh, how
Can
nice.
you hear me now?
Yes, yes.
Okay.
Fantastic.
How are you?
I'm good, and this is so kind of you to give us your time today.
No, not a problem at all. I'm always happy to, talk about mental health.
Yeah. So I'm just going to dive into the questions. I did a little intro about you, which I think you can see in the recording. So the first question I have is postpartum depression is a term which is quite familiar to everyone. But can you talk to us a little about what perinatal mental health is and why this period is particularly one of vulnerability?
Yeah, sure. So perinatal is basically, so natal is delivery and perinatal is anything surrounding the delivery, right? So traditionally, perinatal period was focusing a lot on just the delivery aspect because that was the time when things drastically change for the woman. But now, from a mental health point of view, the broader understanding is anything that includes, the whole idea of thinking about a child, conceiving, delivering, and the initial few years of bringing up the child, the initial few years. So perinatal period is really, for us, at least in this profession, we look at it from the time of conception. So it would include even when women or families are trying to conceive and not being able to, right? Or they have a mental health issue, they're struggling with it, and then they're faced with the choice of should I be thinking about a child. So that is something that is included. The other aspect, of course, is pregnancy. And traditionally, pregnancy is something that is always considered as, oh, this is like a happy time. Everyone is happy, great, you conceived, and this is the next chapter. But for women, many women, especially in our current times, but even traditionally, they've struggled with their mental health, but not even been able to talk about. So, and now with the women working right up till the last day, of their delivery, they are not just sitting and relaxing and enjoying their pregnancy. They're also trying to manage everything during their pregnancy. Sometimes getting ready to go on maternity leave, which means handing over their work to someone. And, so there's a lot happening in the pregnancy period. And then delivery, of course. During delivery and the initial few weeks after delivery are the most vulnerable time physiologically for a woman, for any woman. And then now we know that up to 2 years, 2.5 years after delivery, she remains vulnerable to develop any mental health issues. And for a woman, if she is going to develop a mental health issue anytime in her life, this postnatal period or the perinatal period is the most vulnerable time of her life.
Okay.
Right. So from a mental health point of view, we try to focus on this period, which is right from conception to at least up to 2 to 3 years of the child's age. That, is perinatal.
Okay. So that explains a lot. So perinatal mood and anxiety disorders can show up across a spectrum of symptoms. Can you talk to us a little about what those symptoms would look like?
So the commonest condition in terms of in perinatal period are depression and anxiety. In fact, anxiety is quite common and not really talked about much. So I'll talk about anxiety a little bit. In the day-to-day parlance, we talk about stress, right? So let's say if COVID happened and we were all worried and we were all stressed for the right reasons. So when there is worry, that is like the starting point of anxiety. When it's excessive, when it's excessive and not justified to what's happening around us. So, for example, a person could be anxious if she's been trying to conceive for a long time and not able to such an extent that she's not able to understand, what are the processes that the doctor is explaining. She needs to take care when she needs to come for tests. So the worry is taking over, right? So constantly worrying, catastrophizing, thinking that there'll be a negative outcome, worried for the sake of themselves, but also worried about others, the baby, what is going to happen to the baby. And there may be behaviors that can be done to manage the worry, either to avoid, so I'm not going to go talk to the doctor because when I listen to the doctor, I get very worried. Or, excessively reassurance seeking, trying to look for, tell me if this goes wrong, what should I do? That goes wrong, what should I do? So anxiety is something that can, mean excessive worry. It can affect sleep. It can make someone so preoccupied that they may not be able to calm down, settle down, not able to relax, not able to concentrate on anything that they need to do. And the postnatal period, what can happen is, especially for mothers who might be anxious without realizing, there's so much to do, right? So they get busy in doing to manage their anxiety. So whatever they might be having to do naturally, like, look after the baby, feed the baby, wash, bathe, there is a excessive activity to make sure that they're doing everything. And sometimes it might look like they're doing things, but they might be just trying to manage their anxiety.
Yes.
So that's postnatal anxiety. Depression, you see similar symptoms in depression, but in depression, what can happen is the mood goes down. So there is a consistently feeling low. Now, postnatally, initial few weeks, someone can feel low. Women often feel low. About 75 to 80% women feel quite low and the hormones are just crashed. So first 2 weeks, it's common to have that, but not being able to get out of it, not feeling joy even in the simple things or even big things, like the baby smiles and they look at it and say, okay, that looks like it's a significant event, but they don't feel anything. Right? So they're not able to experience joy in things that they usually used to enjoy, things, that they used to like before. So depression can be where they're, persistently feeling low, not able to sleep, not able to enjoy, having a very low appetite. And in severe cases of either of these, depression and anxiety, there can, of course, be like a complete reduction of activity. Functioning goes down, not being able to, think that things will get better. The most common thing that a lot of women say is they feel like this is it. This is how they're going to feel forever. They can't remember what it was like before they had the baby. And they feel like, okay, now I've entered this phase and this is how I'm going to feel all the time. So that helplessness is there, hopelessness, oh, it's never going to change. And in severe cases, they can also feel like they don't want to live anymore. They can have thoughts of not wanting to live. They can also have thoughts of resentment. Why did I have this child? It's just changed everything for me. And that thoughts, of having kind of negative thoughts about the pregnancy and the child is so common, but it's so difficult because nobody can share it openly. Immediately they'll get judged. What kind of a mother are you?
Correct.
Right? But it's not like a mother is deliberately sitting and thinking about these things. What really happens is she gets these thoughts because of how overwhelmed she's feeling. But she can't even share because everyone is going to judge. So it's quite a tumultuous time. So these are the two most common conditions. In very severe cases, we see, and there is again very quickly after delivery, some women can get psychotic, where they completely lose touch with reality. They're not able to, just keep themselves cued into what's happening around them. They might feel like someone's trying to harm the baby. They get paranoid thoughts, and that's very rare. It's like 1%. So small proportionate, and that is rare throughout, even in India compared to even global figures. So these are the most common ones. There is also something called as the anxiety spectrum may include things like post-traumatic stress. If a woman has had, say, a loss of pregnancy in the past, right? Around the time of that month when they might have lost the previous pregnancy, they might start getting trauma symptoms. So that is another common thing that can happen. or in a previous child, if they've had very difficult postnatal period where the child was in NICU or, had medical issues, they might have dealt with it. And now in the second child, they might start experiencing really anxiety that, oh, what if this happens again? So then post-traumatic stress is another thing that can happen depending on their life events. So the common ones are depression, anxiety, and variations of these in the perinatal period.
All right. And how would it affect the fetus in utero or the baby postpartum? What are the likely effects?
Yeah. So the most overwhelming evidence now we have is that if there is untreated doesn't mean only medication, right? Untreated means not just address. If it's not picked up, anxiety or depression in pregnancy, we know that it actually affects the growth of the baby. So babies who are born to mothers who have had untreated anxiety or depression, they're often small for gestational age, what we call a small for gestational age, right? So their birth weight is lower than someone who's had anxiety but has been addressed or treated, right? The other thing that can happen is they are more prone to what we call as the adverse obstetric events, like premature delivery, also complications in pregnancy. Last trimester complications are more common. There is also documented evidence of spontaneous abortion if there is severe anxiety and depression. So these are the physiological impacts on the baby. There is also enough evidence to tell us that there is something, when the mother is anxious during pregnancy, her cortisol level rises. So it actually affects the hypothalamic pituitary axis in the fetus. So there is increased sensitization. So it's kind of setting the sort of risk factor for the baby to be fussy when it's born, to go ahead and develop other anxiety disorders. So antenatal depression and anxiety is linked to the child in later childhood life developing oppositional defiant disorder, ADHD, anxiety disorder themselves, adolescent depression. So we know that physiologically it can affect the child, and psychologically it can affect the child even before the child is fully born, even in the fetal stage. In the postnatal period, so if you think about the antenatal, if this is already set as a marker, and many women, we know that they might have had depression when you picked it up in the postnatal period, but it might even have been unnoticed during pregnancy. So they might have a baby that's a little bit fussier. And at that time, it makes it harder. So if a mother is depressed after delivery, her ability to just bond with the baby gets affected. And what we call as, so the baby learns about regulating its emotions through the mother's expressions. And, mother can't sort of mirror the baby's expressions. It's just trying to manage her depression. And most of the mothers we see in India, they are not going to just sit, and even very severely depressed mothers will just keep doing what they need to do. They'll just keep looking after the baby. And they feel like whatever it is, if I'll just manage somehow, I have to look after the baby. So there's a mechanical looking after, right? But there's no emotional regulation. There's no like looking at the baby and gazing. And all that emotional regulation that happens by just positive gaze that they get from the mothers, that is not available. So baby's ability to regulate itself goes down. And we know that if there is an attachment difficulty in early childhood, then it has a lot of implications for later mental health issues in adult life, and it kind of sets the risk factors from the beginning. So it has a lot of impact on the fetus and on the baby later.
Yeah. So it's not just the birthing parent, but the partner also can show up with mental health issues.
Absolutely. Now we have, without any doubt, evidence that fathers can have what is called as postnatal depression. And it's a bit sad that it's not recognized enough. We are just about starting to talk about postnatal depression in women, but the upheaval that a man goes through, there's a complete change of life, and there is not that much acknowledgement that he might be also struggling to this whole change. He's lost a partner. She's completely like taken over, by the baby. And he suddenly has to now look after a baby that perhaps many men in our generation don't have a template of how her father can look after a baby, because their fathers might not have done it. So now they suddenly need to know how to do this. They have to be hands-on fathers without any idea. So it's a huge change for them. And they don't get that much of maternity leave either. Like there's maybe like in some companies, there's a couple of weeks of paternity leave, right? So they don't get that much leave. They also have to go to work, and they also have to come back and help. And it's a huge upheaval. And if there are, and another factor that affects Indian families and Indian dads is that there are people in the house, like either his mother or his mother-in-law, and they have to navigate all of that.
Yes.
And because the mother is busy with the baby or is getting affected by the father has to like put out all the fires, has to make peace with everyone and be there for his wife. So definitely the role of the father has changed over the years, but the support that dads get is not caught up with that role. So it can definitely affect father and can affect, how he is able to then support his wife, or how he can support the child and take over if the wife can't. So father's mental health is very, very important as well.
So are there any red flags in a parent's history that would tell you, yeah, like this particular parent is going to be at risk for perinatal mental health issues? What do you look out for?
Yeah. So the kind of obvious red flags is if they have a history of mental health issues, if they have a history of anxiety, depression, even if it is treated, even if it is treated in the past, that's one thing that they have to be extra careful. That doesn't mean that they have to have medication. They just need to be in contact with a mental health professional during the perinatal period. So red flag is previous history of trauma, like I said. If they have pregnancy-related trauma or miscarriage or loss of a child, but any other trauma as well, trauma from their upbringing. So previous history of trauma is another red flag. Existing psychosocial stressors. So if they have, not very supportive family, if they have a lot of conflict in the family, that can be a red flag. There are also factors in the husband that can be red flags. If there is unemployment, we now know there's unemployment in the husband, that can actually impact on the mental health of the wife as well. Of course, it'll affect the husband, but that's an added stress. If there is substance abuse, like alcohol dependence or smoking in the husband, that can also be a red flag for the mother, for the wife, right? And not having a support, like not having a person that they can share with. That is a big red flag as well. And often we don't realize that. Like there is an assumption that, oh, your mom is coming to help you. Great. You're sorted, or you're going to your mom's house. But it's often not necessary that they may have a good relationship with their mother. So not having a supportive, how they perceive as support, that's another red flag. Another red flag can be also, not having a very stressful work environment. And many women don't get the right kind of support. It's definitely improved, in the last, especially the last 5 years, it's drastically improved. But what can also happen is that they might be expected to go on maternity leave, find a replacement for themselves, upskill the replacement, and there's not a guarantee that they might get the same job when they come back. They might be downgraded when they come back. So a lot of these mothers who are working mothers come with that stress of, I don't know if I'll have the job when I come back. I have to make sure that I keep myself updated during this leave. So the work stress and how supported they feel during work is a very big red flag to keep watch out for women who are, taking that break from work, or even women who are in, I guess in our field, like healthcare field, there is no concept of part-time work in training. There's no concept of, especially trainees. So, I see these young doctors, I'm sure there are other fields like that as well. There is no concept of taking a break and coming back and, working part-time. So they just have to jump in full-fledged. So a stressful work environment can be definitely a red flag.
What about birth histories? Like if you're meeting them postpartum, what would you be looking for in their birth histories?
So definitely looking at, first of all, how the pregnancy went in terms of medically. Was it a taxing pregnancy? They have a lot of medical issues. And if that is happening, what may happen is just leading up to the birth, they may have already heard a lot of, we have to take extra care. We have to make sure we watch out for your blood pressure. You have to get admitted sooner. And so just leading up to the birth, what could be happening? That's something that we ask for. Also, just the birth itself and their attitude towards what did they expect. And usually I tell the mothers that, you should have a choice and a desire, but don't be married to that desire. You might want a vaginal delivery, you want a normal delivery, that's good. In fact, you should ask for it. But if you are going to be so caught up that I have to have it that way, then you will find it very stressful, because you may not be able to make the right decision at the time if there is a risk factor.
Yeah.
So you should have a choice and a desire, but be open-minded to change it around if there are risks coming up. So the women who struggle with most is if they've not had the choice that they wanted, not felt like they've had a choice. And that's unfortunately still the case, where they've not had sensitive birthing spaces, where they've not been explained what's going on.
Yeah.
You know, they just sort of been pushed in and slapped around and said, come on, now you put your legs up. And it's been quite a traumatic birthing experience. And it may be that the healthcare facility is not sensitive, or it may be that it is a risk issue and the healthcare community around them or the team is just focused on managing the risk.
Yeah.
They forget to be sensitive to the mother because they're like, oh my God, we have to save the right? So the birth experience, what was it like for the mother? And another overwhelming thing that I often ask for, which happens to most mothers, is even if they've had a good pregnancy and everyone is looked after them, the moment the baby is born, the focus is all on the baby.
Yeah.
So almost everyone is like, how's the baby, what's happening to the baby and all that. So the emotional care that the mother gets is very little.
Yes.
So there is like, okay, do you want to eat? Have you eaten? Have you drank? are you sleeping? The physiological thing gets taken care of, but emotionally how she's doing, not anyone is asking.
Correct.
So immediately after birth, the attention shifts to the baby, and that can be very traumatic as well. So they've had a traumatic experience, and if that is one thing I would ask for, and if they felt supported after delivery by their husband, mother-in-law, mother, father, whoever, or the postnatal staff in the hospital. So that's something I usually ask for. Of course, medically, if they've had complications, if they've had like, a tear that's not healing, or a lot of blood loss, not being able to breastfeed. I mean, breastfeeding is a huge other challenge for a lot of women.
Correct.
What they go through, right? But the birthing history, this is what I kind of tend to focus on.
And I suppose even NICU families or IVF parents tend to go through the whole gamut of, anxieties and are terribly at risk for mental health issues.
Absolutely. And for many of them, if they have come a long way in getting pregnant in the first place. So this is like a precious pregnancy.
Yeah.
So every time there is a red flag, oh, we have to do the scan. Oh, we might have to repeat the scan. The placenta is not in the right place. Any of those normal things that pregnant women go through, for an IVF parent, that's like, I have to make sure I see this pregnancy through, right? So it's very stressful.
Yeah.
Any smallest hint of risk is stressful for them.
Correct.
So definitely we go through a lot.
Correct. So I think the first point of contact with the caregiver would be the obstetrician. So does this mental health conversation happen at all? If not, why not?
Yeah. So we did a little survey a few years ago where we just asked women, do you think mental health is important in pregnancy and postpartum? Do you think it's important for it to be addressed? And do you at any time in your perinatal period get asked about your mental health? And overwhelmingly, they said no. And I feel like it's a combination of things. It's that the training hasn't been sufficient so far. And I know quite a few obstetricians that I work with who are very sensitive. Despite not having had any training, they just pick up and they ask, right? A lot of the times, there is also, like who's going to break that question first. So obstetricians are thinking, if she has a problem, she will tell me. The patient is thinking, if the obstetrician asks me, then I'll tell them. So if each is waiting for the other to tell, and ultimately nobody asks.
Correct.
So that is something that can happen where they don't realize that they need to tell the obstetricians, and obstetricians may not realize that I need to ask the question, only then she's going to tell me. So that's one of the things that can happen. Another thing is lack of resources. So even most obstetricians I know, they are so busy. Even if they want to address, and that's what they tell me, the ones I work with, they're amazing obstetricians. They tell me, even if I want to address it, I just don't have the time. And I don't have skills to manage. If I ask them a question and I find out something, then I don't know what to do. And if I find out that they need to see someone, I don't have enough professionals around me who can see them. So it's barriers in so many areas. There are not enough mental health professionals trained in this. There are not enough obstetricians trained in this. So there are barriers enough and it's not related to only one profession.
Yeah. What about the parents? Do you think they are insightful, or do they have the words to describe what they're feeling?
No, very, very rarely. It's definitely improved. And I know we are sitting in Bangalore. So like these metro cities, it's definitely better. They're able to speak out a little bit. So, but even their words might be a little bit guarded because they're worried how are they going to be perceived. If I say I'm depressed, what are people going to think? I shouldn't be depressed. I should be feeling happy. So these notions are definitely there. And postnatal depression, the awareness is improving. So they're able to say, pick up the words around it. But pregnancy, they're still not able to pick up. And they're not even able to come to terms with the fact that they might not be feeling good. And it is a thing. And it is something that many women experience, and they share. So the language, while the language around mental health generally is improving, perinatal period is still a long way to go. And definitely in the tier 2 cities, in smaller villages, it's even further. And I mean, it's interesting. On the one hand, there is a general understanding that the mother needs to be stress-free and calm. In olden times, they used to put all these photos of happy babies in the room of pregnant women. Look at that Murphy baby and this baby. So if you see happy babies, then you'll feel happy. So there is a long-standing knowledge that a mother needs to be stress-free and feel happy for the baby to grow well. But unfortunately, it's the onus is put on the mother, as if it's her responsibility to feel happy, as if she's stopping herself from feeling happy. And that needs to change. Like nobody will deliberately be sitting and making themselves unhappy. It just happens. Need some care, support, and guidance to come out of it. So that level of knowledge is not there. There is a general belief that they need to be happy, but how it should be facilitated, whose fault it might be, and it's not anybody's fault. That language is still not there.
So if there's a difficulty with the language, do you think something like a screening tool or a questionnaire would kind of work? I know you're working on something like that.
Yeah, definitely, screening tool works. Also, the difficulty we've had in adapting what's happening globally. There are a lot of the countries have a standardized screening tool, which is like part of the antenatal file. In fact, many computerized systems in the US and everywhere, you can't actually enter the whole data unless you enter their mental health screening score. Right? So it's just incorporated in the system. And we are working towards that. Karnataka recently introduced these 2 questions in this AMA card, Thai card, which they have. They passed the policy recently. I don't know whether it's what's happened in the ground reality, just to ask them about their mental health. So
what are those questions? What are the questions?
So they're getting asked, like, have you ever had mental health issues in the past? And currently, are you struggling with any mental health issues? Just to ask them, like, how is your emotional state? Right? The screening tool that we are working on. So one of the barriers that we realize in India, at least, even, and this is across literacy level, socioeconomic level, even the richest to the poorest have a barrier that if you ask them a question, many will respond accurately, but many will just say, no, I'm okay. Because they are reluctant to answer. So just asking about mental health may not be enough. Just ask once may not be enough. That's another thing. We need to ask them at different stages in their pregnancy, postnatal period. If you asked once and you had no, doesn't mean it's not going to change. Or doesn't mean that they've given you the correct answer. So screening and asking based on the screening tools, and I can share them with you if you need to share it with the, the screening tools that we're working on. That's one thing, to ask the questions from the screening tool, ask them multiple times during the perinatal period. The other thing is asking about the risk factors. They may not be able to tell you, if you ask them, are you feeling sad? They may, no, I'm fine. But if you ask them, do you have anyone to support you? Like the risk factors we talk about. Does your husband drink a lot? Have you had a history of trauma? That is easier to answer. So risk factors based screening can be a little bit easier to ask for than direct mental health. So that's the tool that we've been trying to work on, in just picking up risk factors. And it may not mean that they have a mental health issue now, but if you're able to pick up adequate risk factors, then we may be able to get them the support before they become unwell. So definitely there is screening. We are also upskilling obstetricians, and we are in the, we actually talk to pediatricians and neonatologists to upskill them in terms of mental health courses. We have short courses that we're working on. We have been running a course for obstetricians just to sensitize them and help them, do basic counseling. What we also realize is obstetricians are in a unique position. For a healthy woman, she's not had any medical issues, the only time doctor she's going to come in contact with the obstetrician in her life. At least till the age of 30, if she's not had any health issues. So it's like the optimum time for us to pick up risk factors, and the obstetrician is the optimum person in the right place, right? So training obstetricians, we also, I think, training midwives and nurses and all the allied staff that the mother comes in contact with. That's very important as well.
Correct.
They need not have, like, a degree in mental health. They just need to be picking up or adding their own skills. They already have good skills. They need to enhance them to widen the repertoire.
Correct. So I think just getting a lens and the language about mental health issues, that is important.
Absolutely.
Yeah. Your organization was also part of the Beat the Blues campaign with the government of Karnataka. Is that where the Amma card came in? Or is there something else happening? Yeah.
No, the Amma card. So Amma card has been there for a while. Like it's a like antenatal card. And the NIMHANS team, there's a perinatal department in NIMHANS. They've been working with the government of Karnataka to upskill many of the smaller towns, and they've been trying to talk to them about introducing mental health screening. And recently we had a very enterprising young like a mental health advocate. So she started this NGO, and she said, okay, I want to take it up as a challenge. How come we don't have mandatory screening for mental health? It should be all over India. So she she started a campaign. She went and met the health ministers, and she was able to, she was a catalyst in making sure that it happened. And her NGO is called Patronus, and I think her name Patronus, and her name is Anvita.
I know. I looked her up.
I think there are lots of voices. Yeah. So there are lots of people like that. And Kerala government actually was the first one in introducing mental health as a as a part of the antenatal health system. And now lots of states have taken up the challenge.
Okay. All right. So suppose a parent decides that they want to come to you for therapy. What does that look like, Dr. Ashlesha?
So what we do is I'm a psychiatrist, and I have a psychologist and a team of other professionals as well. But ideally, we would see if they need to see a psychiatrist, or just seeing a psychologist is sufficient based on the history. So I spend like at least an hour and a half with them, first on their own. Then the next session, I usually do a 2-session assessment so that I don't catch them at only one particular time. Then they might be in a good mood, or they might be a terrible. The second session, I would talk to their family members, get some information from them, but in their presence. So they know what the family is also thinking and how they can be supported. Then we make a decision, do they need medical intervention? Do they need medication, or just therapy is sufficient? And if they engage in therapy, then they start seeing a psychologist. And the psychologist usually sees them once a week. Okay. With the psychologist also, I mean, we have become a lot more flexible. And I think for perinatal population, it's been very helpful to be able to see them online. Okay. So do not have to travel. So if they are close by and they want to travel, they can come in person. If they want to see us online, they see us online. We also are very sort of flexible that the baby can be around. If they need to attend to the baby while talking to us, that's fine. We also do something called as a mother-baby intervention. So if they want to improve the bonding with their mothers, we encourage them to come with the baby and look at how their anxiety might be preventing them from being there for the baby. But often what ends up happening is we tell them, we notice for them that they're already doing such a great job, but they didn't realize it. So helping them realize they're doing a good job, but they don't have the confidence for it. So these are the different things we do with them.
Okay. And what if treatment is not sought? What is the effect on the parent in the current or in the future, or on the baby?
Yeah. So definitely mental health issues in the baby is something that we know is a risk factor. Untreated mental health in the mother, father, or a very conflicted environment in the house has an impact on the baby right from the beginning. Right now, it definitely can be corrected, and they have corrective experience of maybe a nice, kind grandparent, or schooling experience, or neighbors. So in India, we also have a lot of corrective experiences, but the risk factor is set. So if they experience an adverse event later on, if they fail in an exam or they have some trauma, this risk factor makes it harder for them to get help later. So for the child, the risk factors start in the womb. for the mother also. Now, if she's not had a treated a mental health issue, she's first of all not enjoyed this time, the most crucial time of their baby growing, and the first smile and the first walk. They're missing out on that. They also then leads to sort of rifts in their relationship, in the marital relationship, conflict with family, and it's like a ripple effect.
Correct.
And it can also impact on them being at risk of developing a mental health issue in subsequent pregnancies. Right? So untreated mental health issue now can put them at risk for something like that happening again in the next one.
So it's very important to address it.
Absolutely. Yeah. Okay. And there are enough scary celebrity stories we've had of mothers, either committing suicide or ending their lives of themselves because it's unbearable. And that also is happening. It's still rare in the larger scheme of things, but it's happening, and it's very unfortunate because it can be completely avoided and managed.
Correct. So in your 20 years of clinical experience, is there any story that you remember and that you would like to share with us about parents that you would have counseled?
I have so many stories, but so I'll tell you the stories of the first time, and this is even before my training. I remember I did my basic psychiatry training in the UK, and we had what we call as occupational session when we first start a job. And the first thing this occupational therapist told us is that if you are feeling mentally stressed, please seek help. And she told us the story of this psychiatry trainee who became pregnant. And during her pregnancy, she started experiencing anxiety, and she started having negative thoughts, and, she's not going to be a good mother. And unfortunately, she felt she's a psychiatrist, surrounded by psychiatrists, surrounded by mental health professionals. She just didn't feel like she could tell anyone this. And when she started realizing that it's actually getting quite worse, she also felt that she can't talk to her colleagues because, she works with them. So she felt uncomfortable talking to people she worked with. And unfortunately, she became so unwell after delivery that she ended up killing her, taking her life actually before delivery, during pregnancy, with her and the baby. And this kind of really hit me. And I thought, this is someone surrounded by mental health people in UK. And the one thing that the person impressed upon us is you need to seek help. And what they did as a change was that we should be able to seek help from people we don't work with so that we don't feel stigmatized.
Exactly.
So whoever you can, you seek help with. So that time my lens kind of started, I started paying more attention to what are women doing during pregnancy and postpartum. And then what I've also noticed in India are many stories of women just, overcoming and fighting against everyone else, saying, no, I want my mental health to be optimum when I'm looking after my child. I have one person who I'm looking after right now who had quite a traumatic upbringing. I mean, I can't give you too many revealing details for confidentiality, but this is a common story of many women. So she had a very traumatic upbringing, and she didn't have enough people that she could feel like she could go for support. So what she developed is that I only have to manage myself. No one is going to support me. So she became quite self-reliant. And as she became self-reliant, she grew in a career and she got married. And one of the constant difficulties was, being sort of depending on her husband for help because she was so self-reliant. And one of the things that came up for them is, okay, now we need to get pregnant. So she's like, oh my God, I can't, I can barely look after myself. How will I look after a baby? So she actually sought help even before thinking about pregnancy. She's like, I have a lot of difficulties. So I need to make sure that I'm, managing myself before I even get into the pregnancy. And, it's interesting how many people question that. It's like, what's wrong with you? Why do you want to go to a therapist? Why do you want to go to a psychologist? Why do you want to talk to a doctor? But she went to a therapist for a long time. And she worked on a lot of her issues. And at some point, when it became real that she should now start planning pregnancy, she got really worried. And she even considered medication. So she tried different medications. She started taking a medication. She would not just say, yes, if I would tell her, maybe we'll try this. She wouldn't say, okay, fine, if you're telling me, I'll take it. She was like, let me figure it out. What is right for me? What is not right for me? And she really took her time and she's worked so hard. And she got pregnant. And the best part I like about her is that there are professionals who will tell her, some life coach says that you don't need to take medication. Someone else say, are you sure you want to take this? You don't need to talk to a therapist. So she will say, you do whatever you want. You're not going to touch my treatment because I know what I've done. I know how far I've come. So at every stage, she's really worked hard at overcoming her barriers. And you know, the unfortunate thing for her is she's now so self-aware that she's actually doing much better than people around her. And the people who didn't have that history of trauma are probably struggling even more with their own anxieties than she is. So she's navigating her pregnancy right now, you know, meeting challenges, sometimes struggling, sometimes coping, but always willing to do the next thing and actually starting to enjoy how she's navigating her life. So I think she's someone that I almost look up to as to how many times people have kept telling her, don't do this, don't do that. Why are you doing this? And she sort of figured it out for herself and said, no, I need to do this for myself. And it's not been easy for her. So definitely something that I feel like in India, women, you know, have to keep fighting even to get help.
Such an amazing story. And I think I've come to the end of my questions, Dr. Ashlesha. Thank you for your wonderful insights. And thank you for being here and giving us your time. Thank you so much. Goodbye.
Thank you. Thank you so much.
Bye.